Yeah, so, but he was
Bless her heart. On Zoom, our first recording. I was going to try to be on the Yamaha, but there was something wrong with the tower. IT doesn't have it, so we're just doing the Zoom thing today. So the first thing that we're going to talk about is documentation. This is ImageTrend. This is your basic. This is what we use over at Fulton County. I don't have access to ESO or anything else. So this is what we're going to train on today. So first thing we're going to do is we're going to create a run. So let's get started. Where do we dispatch to?
prior to.
What'd you say?
So 70. 74.
Reagan, what'd you say? 17, 70? White, I'm assuming?
Yes.
We're going to be able to see that. There we go. Okay. All right. So how far are we out? So is it day or is it night? What time? All right. So we are dispatched at 19. Let's see. No, that'd be 21. 21:58 en route 2200 on scene. We said we're 15 minutes out. 50. So we're 22:50.
Yep.
Okay. At patient. Baylor 2, so 22:52. Okay. Depart scene. How long were we on scene?
We're on scene for 9 minutes.
9 minutes. So 23:01. At hospital. That's all right. So what time did we actually deliver our patient? Did we have any on the scene or on the wall time? Yeah. Is there a wait period where we in a room? 3 minutes per room. So we delivered 5 minutes once we got there. That's good. All right. So random day. What's the date?
3:11.
Okay. So what happened on scene?
I'll do the one.
How far did she fall?
2 feet, but
2 feet from the bed or 2 feet off the bed?
Off.
So fall. Okay. Any injuries?
full restoration.
How big?
That was
Is-
3 centimeters.
3 centimeters? This is our communication, right? We're on the head.
All the
All right. Anything else? Any hip? Pelvic, back? All right. So 74, we need a C collar, right? Positive blood thinners. All right. Vital signs. At patient at 22:52, so we'll say it took us about 5 minutes to get out to the truck. So that's 22:57. Another 2 minutes to get our equipment on, so that's 22:59. First set of vitals, 22. $16. Pulse ox.
98%.
Cardiac monitor.
83 heart rate, pace, AFib on one.
New onset or
I don't know why, but you think that they're showing it's like really bright, so I don't know if it's like really.
can't see it or oh. There we go. Yeah, it is washed out, isn't it? I don't think there's anything I can do about that. All right, blood sugar. Temp, okay, so 98. All right, so are we thinking stroke? Yeah. All right, possible stroke. We're gonna have a stroke band of 1, 2, 3, 4, 5, 6. There's 6 numbers in it. All right, trauma band, good.
Oh, thank you.
So we're gonna say Z 7, 8, 9, 1, 0, 1, 2, 3, 4, 5, 6. Okay, so we're gonna take vital signs every 5 minutes, every 10 minutes, 15 minutes. every 5. So we're looking at 0, 0. 4, 5, no, it'd be 4. Nope, that'd be 23. Getting ahead of myself. Second set of vitals.
That much.
Not that much.
Wait, so. Are we doing any of the symptoms that?
Here a little bit. Do we want it to go up or down? Okay. So 200 over 102. Are we trending?
Yep.
Respiration still the same? What about AFib? Same? Pulse? So
84, 82.
82. I like that. All right. So do we treat stroke with anything with the blood pressure like that?
No.
No. Good. All right. So do we do anything? Any interventions at all?
Think the lights and drive fast.
Okay. Anything else? Okay. So what's our stroke assessment? Conclusive or unconclusive? Conclusive. Okay. What deficits?
Arms and slurred speech.
All right. Which side?
Right.
Okay. All right. Pupils.
Earl.
All right. How does she feel? She able to talk to us?
Feels great.
Feels great. Okay. She to her normal. All right. So AFPU. She alert when we walk in? She alert to verbal? So she's alert to person?
So let's do person in place.
Okay. All right. Do we find medicines?
Kepra. Actually, yeah. It's just.
What blood thinner?
Yeah, Ben. Multivitamin. Fish oil.
What was that? What was before Zoloft?
say, if you dementia,
Mm-hmm. Warm blood thinner, so we have some kind of cardiac, correct?
they did for the blood thinners.
Okay.
Mhm.
Do we have a history of CVA? Or is this new? Huh? Okay. Allergies?
Okay.
No penicillin? Anything else we need to know for a run?
It's like I'm saying,
Okay, which,
more general impression of it.
okay,
Oh, yeah.
Yep.
She was found in between her nightstand and her bed.
okay.
Possible.
Yeah, so, is there a cell phone?
Headline.
Landline?
No, I.
Life alert? So life alert called? Okay, what time did they call?
Well,
That'd be 10.
okay.
Well, you got called at 9:58.
21:58? Did they notice slurred speech?
No, because they give us the dispatch up the phone.
Okay, no call detected, no contact.
Alright, so. We were at the patient at 22:52 when we noticed our slurred speech. So what time are we gonna say that this last known will time was?
Yes,
Yesterday? How do we know it was yesterday? Kind of where I was going with the cell phone. If there's a cell phone, we can see who she talked to last. And
Well, we don't have one.
well, it sounds like the stroke is coming from the head.
I thought we were
So-
leaning towards bleed.
Brain, yeah, from the brain bleeding, so I imagine last well time would be.
okay,
We're also gonna give her a history of stroke, but we gave all the symptoms. of stroke.
Oh, she has eight.
Why can't she? Right time.
Because that's.
well, she falls and hits the left. It's gonna
Okay, so we are here.
We're doing occlusive or bleed? Right, okay, we're going bleed.
okay. So what time's last known well time? Okay,
Right, yes, but they don't like that.
Okay, we got it. All right.
so say a neighbor. Comes over, they see the ambulance. And you're able to ask them when the last time that they've seen her. What is
5 o'clock,
that day?
5 PM, so.
And she was normal?
Yep.
What else do we need? What does their skin color and condition look like? Okay. Y'all happy with that? All right.
We did like a gap assessment, and they make it out before after it.
What's that? Yes.
You call them, or go in, assess the neck of the head.
So our rule, I don't know how it is at Big Baxter, but Little Baxter, if they're over the age of 65 and it's a fall and they're on blood thinners, they automatically get it. Yeah. I did. Somewhere. C color, positive blood thinners and C color.
Oh, yeah, we have the lag.
How far is that transport?
We said 15.
50?
Total was 50, so it's probably,
At hospital 2355.
54 votes.
got probably 10, we dropped her off at mid.
We don't have a bird. I take the bird when they have the bell.
Yeah, no bird. So if we're an hour out, would it be feasible to call a bird?
Right.
Well, this is a consideration because if you're an hour out and you're dispatched for a fall, you got 9 minutes on scene, right? So we're gonna have to wait at least 20 for that bird. And where are they gonna go? Probably back to our hospital. So would we be saving time by just loading and going? Because what are they gonna do any different? Okay, so are y'all not stroke qualified? They do the tele, right? Yeah. Okay.
Five.
So how are you gonna know the difference? How are you gonna know the difference?
At CT,
Uh-huh.
you may give a shout to your hospital and say, hey, y'all might want to figure out if a bird can get here. I think I've got a bleed. I'll be there in 20.
Okay, so what time are we gonna alert the hospital for possible code stroke? 20 minutes out? Soon as en route?
Service.
Okay, so what time?
Yes, median.
Depart scene. 2301. So we called TraumaCom before that, right?
Oh, like,
TraumaCom. $15. And we alerted the hospital. At what time? Good.
Inform the CT machine up.
Yep. The sooner the better. Alerting sooner the better. Okay. Let's see how well we did. So there's people that rave about Elite and how easy it is. There's others that hate it. I've used it a couple times for some services that I've worked for. It's half a dozen, one or the other to me. That's true. It does not. So you do your username, password, and fun tip, your username and password on ImageTrend is going to be the same username and password as to get into your EMS portal. Basically, it's just the backside. Also, every service this platform is basically used, it's just ESO. ImageTrend absorbs the information from ESO. How we found this out is over there, when they log in, the Baxter employees log in, you have to choose which facility. And so since ESO is used over here, isn't that right? ESO? What is it? Zoll. Okay. Okay. So Zoll, um, it's absorbed into that system.
ESO. Okay, all right, thanks.
Okay. What do y'all use?
Yes.
ESO. Okay. All right.
The front end's a lot easier than the back end.
Yeah. It'll always pop up, tell you about your license. I'm waiting on Dr. Schultz. Got that taken care of. Sometimes it will fail. I haven't had it do it very often as of late. There we go. I figure this is the internet here. So this is just some announcements up here. You have different tools. You can go back into my existing, and there's nothing HIPAA related here. It doesn't show it initially, but if you click on EMS, view existing, looks like Tim's already filed mine. I haven't been there in a couple weeks. But anyway, you'll have your all of your information. There'll be a list there. 2 ways to create a run. You can click here at new and incidents. You're going to have 2 different options. Click the one with the star. The thing about image trend is there are certain places that you want to do first, because if you don't, it will disappear out into digital land and you will not be able to retrieve it. And one thing that we didn't do is what we didn't sign it. So that's a new thing for us, and I have a tendency to forget. So I always go to the signature first before I go to my primary run. Sometime today. There we go. Eli, do you do runs over there? Documentation?
Yeah.
Who's who?
You know what? This last time I did it.
Do you want two teams or do you want to play against one another?
Farmers.
It's a big farm, big farm.
I don't know, I like the competition.
All right.
What's the judge's role? Still a judge if you do that? Is the judge just? Was it the flag first?
Yes.
No, that's just. And break it. Stand it still. Right.
All right. So since the internet's not cooperating, Amber. We are going to do Jeopardy. Maybe. Huh? Yes. Oh, all right. 4 teams. Brayden, you may need to sit over here on this side where you can see everybody. All right. Eli, what do you want to be? Aaron? Tomato. Gavin?
You see.
And Nick. All right, so if you throw down before I ask the question, you're automatically out. Let me ask the question first, okay? All right, y'all ready? Okay, so who wants to go first? Brayden, why don't you go ahead and pick? Small intestine. Where's it at? White quadrant? Right? Right, which quadrant? Okay. Anybody else? All quadrants? Upper quadrants? To both upper quadrants? Nick?
Do we got that underneath it?
Both, okay, so we got two uppers, two lowers. Right upper quadrant. What was the last one? All, okay, we ready? Oh. Oh. So nobody got that one. That was for 400. Mm-hmm. How it works now. All right, Braden.
Common root word 500. Oh my gosh, you know so much more.
What does Ophir mean?
Over there.
Nobody? I should have got my clock out. We're gonna say, you're saying mouth? Are you answering? Did you put your flag in the air?
Answer to another.
Oh, it's out. Okay. All right.
Wait, so if you don't. Dang it. Yeah, I know, yes.
So we're gonna have to go over midterm, right?
I see. That's a little bit.
All right, Braden. What does felt mean? Okay. Are you answering? Okay. Anybody else? 8 seconds. Okay. Veins.
Okay, so that's pretty good. Huh?
That is. I'll give it to Gavin. You want to go 50-50? All right, Gavin.
The quadrants for 100.
Where's the appendix at? Right lower. Okay. Everybody agree? Eli now. Left lower. So we got a right lower, got a left lower. Are we ready?
I think it's over here.
Right lower.
Sorry, doesn't lie.
So who got it, Aaron? Ooh.
No, I'm sealed. Can you use tomato?
He is tomato. Yeah. All right. Anybody, did you get it? You said left?
Oh, we're just giving it to everybody.
Well,
Oh,
Yeah.
I thought it was like the first answer. It's it.
yeah, we'll do first answer. All right, Aaron.
Let's go with.
We'll do the first person that answers as the full points, and then we'll ask everybody, see if everybody's in agreement. And if somebody else gets it instead, if it's the wrong answer and they get it, they get the point. Quadrants for 500. Does that make sense?
Yeah, well, what if like Aaron got the right answer, or Ron guessed the answer, and like we all said it was the right answer, and we all got it right. We all get points.
Do y'all want points? Do y'all want to do it that way? Half points? Okay. Liver. Okay.
2 over 5.
Okay. Mostly the left. Okay. Upper right. You're saying upper right?
Saying both uppers.
Okay. Ooh.
It barely does it. Yeah, it's like a little bit like right here.
Who was it?
Yeah.
Ah, I'm getting y'all mixed up. All right. Gavin,
200.
bleeding.
Both.
Everybody agree? Sign. Okay, 2 signs.
Well, we got my intro or extra?
Yeah, true.
Don't make it hard. Nick, what do you think?
No, like I feel like that makes sense.
Both? Sign. Eli gets it. Did you say sign? Okay. Are we splitting it?
I think he said first.
Eli's pineapple. We can just. Actually, I used to sign.
You are tired. All right, Eli. Ooh. What is it? Mini? Okay. Everybody agree? You look confused.
No, I know, like, multiple, but I don't know if there's a number associated with it. And I don't know, but many.
Mini? Yeah. All. So I'll give it to everybody. And that was for 500?
Yeah.
Good.
All right. You answered it first. 100? 4. 2?
Yeah,
Both? Okay. You look confused now.
Oh, I know what it means. I'm just trying to figure out what the answer they want is. I think it's both. 'Cause
Ambidextrous. Okay. What do you think? Both. Give him an extra 100 because he answered first. What's him? Oh,
Two spheres.
Half?
Yeah. Half. Well, it's sphere.
means what?
Sure.
Okay. What about
Hemi means-
medical?
hemi means- yeah, hemi means
It has a hemi in it.
Or like identical.
Half of a sphere, so definitely.
Half.
Hemi,
You agree?
the word, the prefix hemi does not mean sphere though. It doesn't like pertain to.
Half. All right. Who got it? Okay. I think everybody was in agreement though, right? All right. Let's see, let's let Gavin have, since he answered first. Are you Seal? Okay. All right, we'll go ahead and take a break. So I'm running low on battery, so I gotta get my charger. So we'll come back at 10:30.
Okay.
I don't mind to do that whatsoever. All right, we ready to get back into the game? Judge, you gonna judge from there? Can you see them all? Okay. All right, who was last? Who won? Gavin? Okay.
Like prefixes for 100.
100.
Wait, I'm gonna wonder-
Raise your flag.
I mean. Diplomat.
2.
Use it in a sentence.
2. All right, we got 2 for 2. Nick? Okay.
With you, because I have no idea. Oh,
Good.
what's that? It's only for one, right? I think we should do it.
Aaron?
You need it first?
I thought Eli answered it first.
Yeah.
Different types of bacteria.
It's bacteria or virus. Yeah, it's because they're bacteria. They're actually
Maybe under the microscope.
yeah. So like you have long chains.
Right. Yeah.
And then
That's like one. What's the one that we can't see? Oh, like a name of, a name of.
let's go.
Excuse me, sorry. Position, prefixes, positions, directions, and locate. Here, numerical, okay. What does the prefix noli mean? Oh! None. Okay. Everybody in agreement? 0. All right. That was for 200. Boy, y'all attacking.
Yeah.
Retro is before.
We got it behind, we got it before. Or behind, first and last. Is that what we're doing? We got two others. What do we think? Back?
Retrograde amnesia. You can't remember what happened before.
Nick is confused.
I'm going.
All right, let's see. Behind. Woo woo. All right. We're stumped all four. I like how you're already trying to put them together. That's good.
That's different.
Yeah. But you guys do realize your prefixes, your suffixes, and then your root word are,
Yeah. There's a lot-
yeah.
a lot to go through it, but Ipsy, I have no idea.
Okay.
I'm gonna say it relates to neuro.
Neuro. All right.
No. It means like again and again and again. Again, like a constant, like
Well, you've given two answers. Which one are you going to go with?
okay, constant. I want to do the constant. one.
Constant, procedure, same. We got two different answers.
No, I'm just repeating what you said.
Oh,
Okay? I'm thinking like constant, like again and again.
same. Woo!
Yeah.
Pineapple, get it? Yeah, I got yours. Anybody else?
No.
You got it.
Do you not see how much farther ahead you are? Okay, next.
Go with prefixes and position.
Mm.
Sure. Next two. In conjunction with.
Pre. We got before, we got pre.
My answer is like with.
Nick's lost again.
I'm trying to figure out, because you've got the parasympathetic nervous system.
Uh-huh.
It's the opposite of the
I
sympathetic.
feel like that's a common occurrence.
Near, adjacent, or from.
None of the things.
Next two, that's adjacent. Adjacent. Two.
So adjacent. Bedding.
Okay, well,
Normal bedding.
the reason it's called that is because you work on your doctor's license.
I guess.
All y'all answered wrong. We're all abnormal anyway. All right, your last answer.
Let's go with 200 categories.
D.
Not normal.
Okay,
Abnormal.
abnormal.
Yeah.
Everybody agree? Oh,
Said decline, didn't you? Dude, that's down.
abnormal is down,
No, he's saying
decline. Okay, I'll take decline. All right. You are pineapple?
It's in blood, lack of.
Lack of blood? Hmm. Anybody else? Oh,
Yes.
what do you think?
Blood.
Presence in blood.
Blood.
Presence in blood? Okay. All right. Blood. Woohoo. Nick, what's next? Nick?
Two suffixes form.
Removal? Everybody agree? Aaron's got his thinking cap on.
Ostomy, that's a surgical hole.
Okay.
That'll be,
Tracheostomy, the colon where you.
like looking at it.
Drainage or removal.
No, it's the surgical hole for drainage, the, usually has a tag on it.
To make an opening. So who got it? No one? All right. Symptom? Everybody agree? Woohoo. All right. Symptom. Got a sign. Two signs. Sign. Who got it? Did you get it too?
We said sign, those two said symptom. Judge, you're fired.
I'm kind of.
Give it a go, give it a go, you're good.
Well, Aaron's the tomato. I took y'all's points away. Didn't I?
There. We'll just leave it there.
Okay. Okay. Don't pick favorites.
Fired.
All right. Time. 2 signs, 3, okay. All right. Are you pineapple? Okay. Okay. All right. Inflammation, everybody agree? Woo! Gavin is seal.
Okay, so 5.
Aaron, to view something?
Sure, look at.
Okay. Good. All right. So Eli actually got that right. So Judge, how are we gonna do that? Because Gavin was actually the second one to raise his flag.
I don't. You-
This could be a mistake on my part. We shall see.
So,
All right, it was my fault. My fault. Give everybody points. That's that dyslexia kicking in. All right.
enter means enter inside.
In and enter.
That's what I meant. I was gonna say, oh,
Ooh. Ooh. Were you first? Was Eli first or was Gavin first?
Yeah.
Okay. All right. So the last person that got it right.
Fix it, position and direction. Having
Okay. Like an abduct
being outside.
outside.
I've done it too, but you're right. Oh, okay, yeah, you're right. I was reading the category, so.
Away.
Away from.
Ooh. Wait.
Away from. Woo woo. Ooh.
Right up, right up. I was so confused.
Right upper. Right upper. Okay. Ooh. That one was a group effort. Group effort. All right.
200. Butters. Clean.
Yeah.
Uppers.
Both uppers.
Pretty big.
Left upper. Okay. Two left uppers. Nick.
Oh, come on.
Okay. Two, your left upper too. Okay. Left upper. So who were the three that got left upper? Eli, Aaron, and Nick. All right. Got 100s left.
Symptom.
One symptom.
They've never been both of them.
Two signs. Two symptoms and two signs. Symptom.
Three.
So is that Eli and Aaron?
No, I got you.
Now it's, yeah.
Gavin and Nick.
Like, have zero column, that'd be the sign. Or above, or above that, one of the. Thing I lived in.
Some are usually subjective.
It's a
It's
symptom,
not-
it could be
I
a
feel
sign
like-
of something else, but it isn't symptom.
Right. Some are usually subjective to the patient, like, I just saying, so, you know, like,
Oh,
but asthma has symptoms of like. Or
Think about your commercials. Diarrhea, coughing, rectal bleeding, death.
suicidal ideation.
All right, two left.
How many rewards for 100? Yeah, it's something like stomach,
Hole,
yeah, whole access.
three. Okay. Nick, what do you go with?
No idea how I want those points.
Oh. Oh. Last one. Ready? Removal. Good. Woo. Ooh. Pineapple. You get the prize for today. Well, I don't have any prizes, sorry.
So my life.
Oh my goodness. All right. Let's see if we can get back into. Guess might just have to wait for another day. Yeah. All right. So, um, you are the paramedic. 232. You need one? Did we read it? We did the kid? Yeah. I thought somebody said we'd already did it. 232.
So they're really potent and they've been fermenting just for you.
I threw them away. All right, so part 1 on 232. You and your partner are dispatched to a local elementary school to help a person who has fallen. On arrival, you are directed to the playground where a young boy is lying beneath a set of playground climbing bars on his left side, curled into a fetal position, sniffing and holding his abdomen. His second grade teacher, Mrs. Hawthorne, tells you he fell from the top, approximately 5 feet, and has a bump to the right side of his head just above his eye. She says she has been trying to keep him still and not let him try to get up. So how tall? Um, how old is he? A young boy? Doesn't say his age. Okay. So what's the rule on children? 3 times their height? Okay. 20 foot, I think, is going to be adults. This is going to be 3 times their height.
3 times our height. It's like
Mhm.
adults I know is 50. That's what I learned.
All right, so what is the correct medical term for the position in which the child is lying? All right. Good. How can knowledge of medical terminology assist you in your documentation for the care of this patient?
Be specific. Patient's condition.
All right. Good. So, what is our ultimate goal? We talked about this a couple classes ago. What are we trying to do? Because we're the ones on scene looking at it, right? So, what are we trying to do in our communication?
Be clear, delegate.
Okay. Yeah. So, when we go in and we tell that doctor, a lot of times one of my downfalls is when we're on an accident, I'm concentrating on the patient. I'm not concentrating on the vehicle, the model, where they were hit, anything like that. Now, if it's upside down, of course, I'm going to notice that. But the rest of it, I heavily depend on my EMTs because you guys are getting the cot out, you're getting prepped, maybe putting them on a backboard, maybe down in the ditch, whatever, so you're closer to the car. All right, next is 237. Or let's look at before we flip, let's look at our primary size up. Appearance, wake, level of consciousness alert, airway open, breathing adequate, and circulation appears normal. So part 2, after briefly speaking with the teacher, you kneel to get at eye level with the child. Hi, I am a paramedic and we're here to take care of you. My partner, Matt, is going to hold your head still while we talk for a minute. Does your head or tummy hurt? The child says his name is Tommy and his stomach hurts more than his head does. He is alert and oriented to person, place, and time and event. His respiratory rate is 22. So is that normal for a young child? All right. His radial pulse is strong and regular with a rate of 104. Is that normal? He says he has been dizzy all morning and it made him fall. Miss Hawthorne tells you that Tommy is a type 1 diabetic. The school nurse arrives and indicates that his mother reported that his glucose level was 183 when he arrived at school this morning. Is that normal? Hi. The nurse also states that he is not allergic to any medications. So 3 minutes in, there's our vital signs. Pupils are equal, round, and reactive to light and accommodation. Why would you want to avoid using medical terminology when talking to this patient? Okay. All right. All right. So when you talk to patients, use everyday terms to improve the likelihood of communicating clearly. As a paramedic, you must also be familiar with terms and phrases that are common in the geographic area in which you work. Y'all ever thought about that? So probably more relative to this area would be like the Amish. Speaking to them. I would say that would probably be not anything against the Amish, but it would be more base level, especially medical terminology, maybe more childlike, just because they don't have training and they're not situationally aware. What are the correct medical terms to describe Tommy's mental status and blood glucose level?
So
Okay, what would be another name for elevated? Good. So it is formed with the prefix hyper, which is excessive, and combining the form glyco for glucose and the suffix emia for pertaining to blood. How would you document that the patient has no medical allergies? Okay. Are we supposed to use abbreviations if they're sanctioned? Okay, was that on the list? All right, next one is on 240. You explained to Tommy that your partner is going to hold his head still and you are going to roll him over onto his back so you can check where it hurts. You observe a golf ball sized hematoma and a small laceration just above his right eye. So the hematoma is that out or in? It's out. We got in.
Out.
Amber says out. Yep. I can hear. All right, so bleeding is controlled. The patient's pupils are equal and reactive. His abdomen is very tender on his right side, just below his ribs, and bruising is present. So what are we thinking on the right side, just below his ribs? Is that upper quadrant or lower quadrant? Below his ribs? Yep. Upper? Okay. So what is in the right upper? What organs?
Liver, gallbladder,
Let's see, we got stomach.
pancreas.
Our liver. I think the kidneys are on the back side of it, and it's a little bit lower. Kidneys. These are more up here. Yeah.
It's fluttering gallbladder.
Yeah.
So Amber, do you want to say yours again? I'll turn you up.
I can't at the moment. I'm sorry.
Bless her heart. He denies any pain in any other area. Tommy tells you he took his insulin this morning and ate breakfast before school. So 8 minutes in, this is his vital signs. Anything concerning? Okay. So what patient is the patient's head, or what position is the patient's head injury?
Bruising on, let's say, lower ribs, so in the upper right abdomen, medial.
This is going to be on the head.
Head injury. Well done.
Okay. Y'all happy with that answer? Good. Because we're painting that picture, right? We're reverting from civilian to medical, right? Good. Good. Yep. Yep. So
It's 2.2 centimeters. You don't think it's awful.
So, yeah, hours.
Mhm.
2 seconds.
So the book says his injury is on the right side of his forehead, just above his eye. Since superior is the term for above and orbit is the eye socket, it would be documented as superior to the right orbit. Then it tells you can use the little R symbol to replace the directional term right. All right, so what's the abbreviation for the abdominal quadrant that is tender to the touch? Good. All right, 249. Part 4. Well, Tommy, we need to take you to the hospital so they can check out that bump on your head and find out why your tummy hurts. Matt and I are going to put you on a board with some seat belts and fix it so your head doesn't move. Don't worry, it won't hurt, and we'll be right here with you. Mrs. Hawthorne called your mom and dad, and they're going to meet us at the hospital. After applying the seat collar and securing Tommy to the backboard with straps and a seat collar, he is loaded onto the stretcher and into the ambulance. You place him on the cardiac monitor, which shows the sinus rhythm at 98. His blood pressure is 96/54. Is that concerning? Okay. It's what? Okay. And respirations are at 18, but his skin is pale, cool, and clammy to the touch. A while ago, we were dry. Tommy's breath sounds are clear and equal, and his O2 is at 96. What was it before? So what are we doing? Decompensating. All right. You apply a small bandage to his forehead and reassess his abdomen. You note that it is still very tender to the touch and appears slightly discolored. Why is the knowledge of anatomy pertinent when assessing and treating this patient? Good. All right.
It's right lower. It's right.
You hit right below his ribs.
But this is right lower. And that's gonna be where your liver is. Cause that's gonna be more prone to rupture.
So you're saying the kidney is a hollow organ and therefore it's more goodness?
The golf.
So familiarity with the structures and functions of the body's systems, which Aaron described, enables you to better assess the patient and predict potential complications resulting from ocular injuries or those not visible to the eye. In this instance, if you know which organs are located in the right upper quadrant, you can predict possible injuries, which allows for a greater index of suspicion and results in more appropriate treatment and transport to the proper facility. Why would that be important? Okay. So is it going to be the difference between Children's and Baxter? Yeah. Depending on how small, especially. Or we're going to treat a 9-year-old different than a 5-year-old? Yeah. What is the medical term for clammy skin? Good. What is the medical term for, I can't even pronounce that word, phenomenon? Such as pain, swelling, or a rash affecting both sides of the body. You're all correct. Many body structures are bilateral, and certain medical conditions tend to occur either unilaterally or bilaterally, a phenomenon affecting or appearing on both sides of the midline is said to be bilateral. All right, so let's turn to 262 and let's look at the PCR report. Is there anything in our demographics that we don't like? I didn't know there was a part 5. Okay. Sorry.
Very good.
All right. Part 5, you cover Tommy with a blanket and start an IV in the back of his left hand using a 20 gauge catheter to infuse normal saline at a rate of 10. You also assess his blood glucose level, which is now 147. Is that good or bad? All right. You and your crew transport the patient to a pediatric trauma center where Tommy's parents are waiting and give a verbal report to the receiving staff. Then you sit down in the EMS office and write your report while Matt cleans and restocks the ambulance. So these vital signs. These. Didn't really say. It just said young boy. 8. So what's going to be our normal for an 8-year-old, blood pressure wise? You can Google it. Good. 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 All right, so now let's flip over to 262. So they did vital signs every 5 minutes. So do you think turning them from the recovery to supine did anything about the vital signs? And if so, why?
When he was on his side, it helped his stomach feel better.
Okay.
So when we turned him over, it gave him painful. So we need to assess that area. Raise the BP a little bit and hurt more. So,
Okay. So that would be a normal finding.
turning the side from lateral recovery to supine.
Okay.
This situation.
All right. So the summer or the narrative 911 dispatch for a male patient who fell on arrival at scene found an 8-year-old laying, there's your little sign, left lateral recumbent in the fetal position. Why is he in the left lateral? Okay. Which side? So, all right. So is he guarding? Is he protecting? Okay. All right. Holding his abdomen, comforted by the teacher. Teacher states the patient fell 5 foot from the top of a playground equipment and has not been moved. ANO ×4, complaining of right upper quadrant pain. Presents with a golf ball sized hematoma superior to the right orbit with small lac. Bleeding control. Patient states he has been dizzy this morning, causing his fall. Perla and slightly tachycardic and tachypnic. History of insulin dependent diabetes mellitus, for which he takes insulin and has no known drug allergies. Teacher states blood glucose level is at 183 on arrival this morning. Patient states he ate and took his insulin this morning. Further assessment of the patient's abdomen revealed that it was soft but very tender to palpation of right upper quadrant with discoloration in the center. En route, patient's vital signs reassessed and noted above. Breath sounds clear and equal bilaterally. Skin pale, cool, and diaphoretic. Glucose at 147. Patient covered to maintain warmth. Head wound bandaged. Placed on cardiac monitor showing sinus rhythm. Ectopy. Yeah. And a 20 gauge IV, left AC fossa with normal saline TKO. Reassessment finds abdominal findings, upper tenderness, and darker discoloration. Met patient's parents and transferred patient care to receiving hospital without incident. Verbal report given to Mary RN. Written report completed. An ambulance cleaned and restocked. Departed the hospital and returned to service. End of report. So anything y'all would do different?
So. Describing. He standing on top of the monkey bars, or was he hanging?
Let's go back and look.
Like this. Fell, hit his side. And then.
Be 232. So I won't tell you wrong. Yeah.
Hard not to quiet, I mean. That's the whole bit.
Mrs. Hawthorne tells you he fell from the top.
With wang. Side on the way. Yeah, bro, appreciate
Well, I was wondering if he hit his side on the monkey bars. If he slipped.
He slipped, he kind of stopped that, so he probably fell on it. I don't know.
So you would describe that differently in your report?
That's the problem.
Okay. How would you describe it?
Kid was. Good than why it was standing on top of the bar, balancing, slipped and fell, probably hit his side on the monkey bars.
Okay.
That's what I'm thinking.
Okay. Anybody else?
I like that, except for at the end of the tunnel, it's like, written report completed, yeah, ambulance cleaned, yeah, and restocked, like, of course, and then.
That's just like, that's legal. Saying that you are right for this.
Probably just like assume,
No,
if you go to like, the finish, report, like,
if something goes to crap with the next roll, we have that report to base it on.
Gotcha.
Well, so do you say patient states in their reports?
Mm-hmm. I do. So I usually do mine a little bit different. It's because whoever's doing pro QI or pro QA, I try to do like a little humorous stuff because patients tell us the stupidest things, you know. So patient's chief complaint, I always put in their terms. Even if it's like a curse word, you know, leave me alone, asshole. I'll put that as a chief complaint. Mm-hmm.
Don't really want the legal thing.
Yeah.
Something that-
Mm-hmm. Well, again, I just do that, and I'm not saying it's right or it's wrong, but you remember I told you about the state trooper that told me to find something about that call, And so that patient's chief complaint, I'm going to remember that patient that said, "Leave me alone, asshole." So that's just a little extra detail that helps me go back 2 years later and remember that patient. Yes. Yes. Good.
Making sure.
Yes. Are your seatbelts important? Yep. Okay.
They're the covered blanket, secured to the stretcher with seatbelts X5.
Good.
X5. Yeah, I don't know how Baxter gets away with it.
Yeah. We do 5 too.
Our insurance calls up our ass if we don't have all 5.
Yeah.
That's
Two,
pretty dope.
there's 2 cross.
It's like the
three,
child
4.
seatbelts, like when they get through car seat.
We have the racer straps on
You
ours.
have the one that got to put the 2 to the center.
Yeah.
Hate those.
You just crisscross them.
Here, where I have. These 2 are completely separate from the lap belt.
Yeah.
But we also have one cross that does have the center beam.
Yeah. So I really like Braden's answer on how many people it took, because that's an insurance thing. If they're able to walk through the ambulance, they're less likely to not pay.
A lot of your nursing homes will say if they can take money, bullshit.
Yep. Yep.
Right.
Has a lot to do with your PCS statement too.
They walk the clock, I do not want to get the ride back for 3 a.m.
Yep. Good.
Oh, they're bed bound. They were sitting in a wheelchair when I picked them up.
Yeah.
Oh, they have to be stretcher transport.
Yep.
I didn't pick them up out of a wheelchair.
Good. Good.
How's that one?
That's a whole building.
Makes the. In our case, it helps force the nursing home to come get them instead of us having to.
Mhm.
Think,
I see.
well, what they, what Baxter says about reporting. 99% of your reporting is the billing.
Mm-hmm.
Out for. If the rest of the stuff is. So the only reason you report is for billing and insurance. And people. It's like,
And the patient didn't see that report?
no, unless they ask for it.
They can ask for it.
Well, yeah.
Yeah. And sometimes I'll say, okay, I've got to put this in my report, especially if they're foul, say, okay, I'm putting this in the report. Or like if there's something, like if they're derogatory, or if there's something. I actually had a patient, and you guys probably all know who they are, but of course I'm not gonna mention names. A behavioral patient that we transported quite often. And dispatch actually called us and said, "We don't consider this an emergency, but I need to call you and ask your opinion." And the incident was she was hearing voices in her head and they were telling her to touch herself. And so I said, call mom and call the patient back and tell them that if we go out there, I'm calling Adult Protective Services. And so she called mom. Mom said, I'll take her phone away. And she was of age. I think she's in her 30s. And she said, don't come out. Well, 30 minutes later, they called us. And so we had her walk to the ambulance and loaded her on the cot. And I told her, I said, I'm going to call Adult Protective Services. And I said, we can't keep doing this. And she said, okay. And so I documented, patient was advised, Adult Protective Services would be contacted. And I did. So anything like that is good to document, especially on your AMAs. Everything on your AMAs. Patient was informed, still declined, agreed to terms and conditions by signing appropriate paperwork, and was reminded that they could call 911 back. It's very important. Yeah. Mm-hmm.
So most lawsuits come from.
AMX.
Randy was
Yeah.
like, "You're gonna die. You're going to die."
That's what, that's
So
what.
he's literally like, "Yeah, you're gonna die here on the floor." I'm like, "Not." I was trying to. I was literally. I was trying to do my assessment, and then Randy was already at the AMA because he knew he wasn't going. And he tried everything he could. But he was like, "Man, you are going to die from lying on the floor. Your body, you yourself up."
Is that a freak? Was it what? Is that a freak?
No,